Sometimes nasal packing is needed, and this could be like a nasal rocket where they just stuff the packing in the nose. Also, electrocautery can also be used to kind of zap those capillaries and stop the bleed. So patient education is going to look at, we're going to be teaching about manual pressure, what to do if they have a nosebleed in the future, and other treatments and lifestyle modifications like avoiding the use of aspirin and NSAIDs. Nasal saline spray and humidification can also be helpful to add moisture to the nasal cavity, and they can also help prevent future bleeds. Okay, guys, so something that I just want you to remember is that these conditions can also have an impact on our other nursing care as well. So, for example, with NG tube placement, I have had so many instances where I have had patients that have not been there for a nasal disorder, but have a present nasal condition that have impacted my nursing care. So it's really important that we ask the patient, hey, do you have a deviated septum or nasal polyps? Because that would absolutely impact which nostril we can put that NG tube in. And so, upon talking to my patients, they're like, yeah, I have nasal polyps in my left nostril. I'm like, okay, well, we can't use your left nostril then, I guess. And we went with the right one, and voila, we got a NG tube that was able to be placed. So that's super important to ask. It's kind of a little thing, but it does make a big difference. Another consideration is regarding airway clearance. So if a patient has excessive nosebleed, this can impair the airway depending on, how much is bleeding and the patient's ability to clear the secretions. So with any of the conditions mentioned earlier, the patient can become a mouth breather because their nose is blocked. So these patients, it's super important that we help them keep the oral mucosa moist and wet. So we're doing oral care just because when they are breathing out of their mouth, it gets super, super dry and cracked. So I'm sure you've had maybe not a sinus infection, but just a stuffy nose. You can't breathe out of your nose, so you have to breathe out of your mouth. And I know that I have definitely gotten dry just from having a stuffy nose. So just kind of think about that when your patients are having actual nose disorders where it's impacting, their ability to breathe out of their nose. Their mouths are going to be really dry. Okay, one nursing concept associated with this is an alteration in sensory perception because their sense of smell could be altered due to their condition. Another nursing concept is tissue and skin integrity. And this is altered with many of these conditions because there's an alteration in the nasal mucosa. Okay, guys, let's go ahead and briefly review the key points. So the key points to remember include the management for each disorder. So this includes the assessment findings and treatment options. And those are going to be different for each of the disorders. Patient education is going to look at the different medications and post-op care if applicable. The nursing considerations I want you to keep in mind are related to how these are impacted on other areas of our nursing care. So how these disorders can apply to other patient care areas such as NG tube placement and airway clearance. Okay, guys, so that is it on our lesson about nasal disorders. Make sure you check out all the resources attached to this lesson. Now go out and be your best self today. And as always, happy nursing.